Hi everyone, my name is Carly Parham and I chose to do my project on fetal alcohol syndrome, specifically the importance of knowing what it is and the effects it can have on children. So first we're going to go into a little introduction. Alcohol consumption is one of the most detrimental factors in the development of a fetus. It is so strongly discouraged by doctors because of the numerous things that could go wrong with the development process of a baby when alcohol is consumed by the mother during pregnancy. There are a good bit of studies that show about 1 in every 1,000 pregnancies are a baby is born with fetal alcohol syndrome. While that does not seem like a very big amount of babies, I think that if every child that has fetal alcohol syndrome was diagnosed, that number would be a lot larger. So now I'm just going to go into what fetal alcohol syndrome is, some of the symptoms that you could see in children, and treatments and preventions for the disease. So first, a little about what is fetal alcohol syndrome. It is a condition that children are born with due to being exposed to alcohol before birth. So if a mother were to drink any amount of alcohol during her pregnancy, at any point in time, the child could be born with fetal alcohol syndrome. Fetal alcohol syndrome is a permanent condition that can interfere with the baby's development, causing physical and mental defects. So if enough alcohol is ingested, like I said before, during any point in the pregnancy, it can result in a miscarriage, stillbirth, preterm labor, physical birth defects, delayed development, and so much more. And some of that delayed development and birth defects are a result of fetal alcohol syndrome. This is because when a baby does not have a fully developed liver that can break down alcohol like grown-ups do, so it can easily damage the baby's organs and leave them with a lifetime of difficulties to deal with. All right, some of the symptoms of fetal alcohol syndrome. Some of the physical symptoms would include problems with organs such as heart, kidneys, and bones. So the development of those might be a little bit slower in children with fetal alcohol syndrome. They could have smaller heads, smaller brain size, vision and hearing problems, joint, limb, and finger deformities, and then some small distinctive features, facial features, such as small eyes, a thin upper lip, that smooth philtrum right here where the Cupid's bow is. The symptoms for a child born with fetal alcohol syndrome range from mild to severe, with the possibility of physical, mental, and social difficulties present. So those were some of the physical ones. Some of the more mental or social symptoms are learning problems, moodiness, hyperactivity. Some people could confuse that with ADHD, so it's you have to be careful diagnosing a child with ADHD versus fetal alcohol syndrome. Coordination and balance problems, trouble reasoning, poor social skills, stuff like that. Okay. Okay, here are some pictures that I included of some physical symptoms that you could see. So as you can see, this is like a normal child's Cupid's bow right here in the upper lip, and there's that little ridge. And then in a child with fetal alcohol syndrome, it might be completely smooth and their upper lip might be a little bit smaller. And then they could have an underdeveloped jaw, as you can see right here, short nose, low nasal bridge. Those are just some examples. Some treatments for, some treatments for fetal alcohol syndrome. So although this disease cannot be completely cured and the symptoms can be or cannot be, or they are irreversible, there are some treatment options that could better manage the symptoms, whether they be behavioral, social symptoms. So some of those symptoms include taking medications to help aid in those symptoms, and attending behavior and education therapy, And then also parental training training for the parents of children with fetal alcohol syndrome to help better manage and parent the children that have it. This is why it's important for a parent to take note of any unusual behaviors or activity they are unsure about and report it to the child's doctor immediately, because once again, the sooner a child is diagnosed, the sooner they can get treatment, and hopefully it won't affect them as much later on in life if it's diagnosed early. So this is just an attention precaution. There is no way of curing a child completely of fetal alcohol syndrome, but there are protective factors you can also go into if you realize your child has fetal alcohol syndrome, or if you realize a child does, that could reduce the negative impacts. Some of those protective factors include diagnosis before the age of 6, before they get into the school years. A loving, supportive, stable home environment could help. Absence of violence in the child's life, and use of special education and social services such as therapy or like help in school. Some symptoms can be managed with treatment, like medication and therapy and parental training, but they will not go away completely. Just like everything else in life, what works best for one child may not work best for the other. So no one particular treatment is a dead set correct answer on helping a child with fetal alcohol syndrome. It's more like a test run. You have to test the waters, see what works best for your own child. Because it can take 4 to 6 weeks for a woman to find out she is pregnant, it is not uncommon for women to drink during that time of their pregnancy. And during that 4 to 6 weeks, 4 to 6 week mark of pregnancy, the fetus is already developing rapidly. Therefore, it is important that if a pregnant woman does drink, the sooner they do something about it or the sooner they stop, it's better for the baby's health overall. So, like I already said, there is one rather obvious preventing method of preventing fetal alcohol syndrome, and that would just be to absence of alcohol completely when you're pregnant or trying to get pregnant. I know a lot of people don't realize that either, but if you are trying to get pregnant, you probably shouldn't be drinking alcohol either, because that could affect all the things. So there's no amount of alcohol can be consumed during pregnancy that would be safe for a baby. Alcohol use during pregnancy is the leading cause of preventable birth defects and intellectual disabilities in the United States. During alcohol consumption, the alcohol passes through the placenta, which is the organ that nourishes a baby during a pregnancy. Even a small amount of alcohol could harm a developing a fetus and increase the risk of miscarriage, stillbirth, or any of the symptoms listed in previous slides if born alive. And just to conclude on all that we've learned about fetal alcohol syndrome and the effects, as the effects of fetal alcohol syndrome increasingly take over a child's life, it is important to understand the potential severity of the disorder and actively help prevent the same problems from reoccurring. By gaining a better understanding of what fetal alcohol syndrome is, what it prevails as in children through these symptoms that we talked about, and what treatment options there are for it, and how to prevent it from ever happening, we can hopefully recognize those children that went unnoticed with the disorder and prevent it from happening in more children around the world. And that is all I have for you today. There's some of my references, and thank you.